of you freeholders by name and face. But because of the positive input that I received from one, that person can continue dependent on Mildred Purdy, that's me, and my circle of friends, and my family, to continue voting for that person and his colleagues. I don't even know y'all, but I still vote for y'all. And I never ever asked y'all to give me a comp ticket to your $100 dinners or whatever. I never asked y'all, right? I still vote for you. God bless you all. And remember, when you turn around, I really believe that y'all believe what y'all say when y'all say with liberty and justice for all. Include the 4-H kids in that all. God bless you all.
Good evening. My name is Jeff Robinson from Rahway, New Jersey. Besides being a county resident, I'm also a county employee at the Division of Social Services. I'm sure you're all aware that at the Division of Social Services, where we administer federal programs like Medicaid, TANF program, food stamps, some of the programs, in particular food stamps, are at record levels. All-time record levels. And that's not just in Union County, that's throughout the state, that's throughout the country, mainly because of the recession that we have found ourselves in. Workers at the Division of Social Services can barely keep up with the work now. You can imagine how it is on the floor with the workers just trying to keep up with all the work day after day. It's tough, but we're doing it. Well, come June 1st, 37 of our workers are going to be laid off. Trained workers who are right now dealing with clients from the county who come in and are seeking assistance for one of these programs, if not all of them. How do you expect our workers to continue to service the clients, residents of the county, to do the work, and to do it reliably and well? We can barely keep up now. You're cutting 37 more. It's not going to happen. It's not going to work. And here's the real ironical part. At a good portion of a lot of these county workers being laid off, not just from social services, but from Runnels and all the other parts of the county, a good portion of them are going to be showing up at social services applying for food stamps. So I think you guys got to go back and take a good hard look at that budget and see what you can do. Thank you.
I'm Barbara Egger. I'm the president of Local 5112, Health Professionals and Allied Employees. I represent the staff nurses, the registered nurses at Runnels. Been paying a lot of attention to what's going on, been looking at all your minutes from your meetings, and I have some comments and some questions. This is a good place, I think, to ask them, because a lot of times when I ask questions, I don't get any answers, okay? Are there any contracts for these departments that are being laid off? Are there any contracts that have actually been signed yet? If they have been, what are the savings going to be? How can you say you're saving any money if we don't know what the contracts are going to be and how much you're going to be spending, and how much you're spending right now in employee salaries and benefits? How long are the contracts good for? Are there any potential conflicts of interest with these companies and county administration members or politicians? And has any consideration of the new employment conditions of new employees has anybody thought about that? Are people going to be minimum wage? Are they going to be part-time with no benefits? This is very important. What are we going to do? What are we doing for our people? What are we going to be doing for our patients at Runnels? Another question I have is there any truth to the rumors that workers are being laid off and then being rehired in a different category, under a different name, to basically be doing the same job that they were doing before? I do believe that this may be happening, and I do believe that it's an end run around civil service and union contracts, and I don't think it's a very good idea. The members of HPAE, we pay attention, we look at your budget, and we're very concerned about the amount of money that's being paid by the county to outside legal firms, particularly when you're laying off employees now. I think that instead of laying off employees, you may want to give some consideration to hiring some more lawyers, because the money that's going out to private firms is unbelievable. And every time you come out with numbers, it's another 100,000, another 40,000, another 60,000, and it adds up. And finally, you guys have a lot of responsibility, and I don't envy you. But somebody made the decisions to do these layoffs, and somebody made the decision for each and every person. They said we would take this entire department, and then they took individual people. I would like somebody to take responsibility for deciding to pay the salary of an executive director of a nonprofit agency who's making more than $50,000 when she's only netting for the nonprofit $6,000 a year. Who's made that decision? Who made the decision that that person does not need to be laid off, that we need to keep that person on when you're laying off housekeepers and you're laying off nurses' aides and you're laying off other people? Okay? Somebody made the decision. When I ask, it's always like this big somebody somewhere, or we made it. Who's we? Who is that? Okay, this is a disgrace. I'm surprised it's not a crime, quite frankly. Thank you.
All right, before we go on, I'm going to ask Kathy Hatfield to come up and address some of those things.
Thank you, Mr. Chairman. I think the one issue that I want to address is Ms. Egger was talking about, what exactly did you want? I'm trying to think of the one question that she had that was, the contracts, right. Currently, we are examining whether there are certain functions at Reynolds that can be accomplished through privatization. The employees are aware of those contracts and those ongoing discussions. We are looking at certain contracts and responses that we've gotten from state contractors, but no decisions have been made yet. And we will be allowing the unions opportunities to bid on the work once we do have those contracts in place. And we expect that to be happening in the next couple of weeks. So, any other questions?
Good evening, Chairman Marabella, County Freeholders, County Manager, public at large. Thank you so much for entertaining our questions and our comments. We really appreciate it. My name is Tina Marie Lopez. I'm an Assistant Supervisor at Social Services and a proud member of Local CWA 1080. I do have a question. On page 44 of your proposed budget, there is an appropriation of $30 million for social service staff. Out of that appropriation for the 2011 budget, $543,000 was put into reserve as not used. That was the largest reserve out of any other department. We are the second largest department being hit besides our brothers and sisters at Reynolds. The question becomes, if we've handed you back the biggest paycheck, why are we taking the second largest hit? The other question that we have is that we ask that you respectfully come back to the table with us. Give us a targeted number of what you're looking for. Our membership vows here tonight to take voluntary furloughs to stop some of these layoffs. Our people will walk out of the door, young people with young children, with no medical insurance and no jobs. We are willing, I am willing as an assistant supervisor, to take a 3-week furlough, and there are several other members that will match that. Please come to us with a dollar amount and let's see if we can meet it. Thank you very much.
Good evening, Brandon Thomas Rawley, part of the Reynolds family. One thing's first, the comment that the young lady just made said the union coming back to bid on the work. About 400 years ago, we had a thing in this country called slavery, where a bunch of people sat around just like this and bidded on people to work. So that comment was just a little bit out of left field for me. All right. It was said to us at Reynolds that this one company could not meet the standards of the money that they were looking to find or whatever, save or whatever the case may be, it was said that that would be out of the question. It would be off the table. This one particular company, this is a big international company that can do the job. Well, that company came back and the numbers weren't right. They don't know that. I know it, all right? It hasn't been taken off the table, okay? Find that a little bit odd, all right? Other than that, go back to my question when I asked the first Freeholder meeting I attended. When are we gonna lay off the people that make the 90,000, sit it back and do absolutely nothing, 150,000 or more, okay? Ms. Brenda and her colleagues, they tried to answer the question for me. Wasn't right where I had it. None of the freeholders answered my question. I decided to do a little research on my own, and I pretty much figured out that not only you guys, but our hospital administrator is kind of scared to touch any of these people making this type of money. Because there's somebody sitting somewhere behind the scenes that is basically controlling this all and is saying, no, you can't touch it. I asked our hospital administrator at a meeting at our hospital, did she ever think about affecting any other areas, saving money in any other areas? She told me to contact my department head. My department head really has nothing to do with that. She has everything to do with the departments that are being affected. I question the judgment of my hospital administrator, Mrs. Wheeler. I don't think she thought the process out too well. We have the 3 departments that are being affected: housekeeping, laundry, and dietary. 95% of them are minorities: Black, Latino, Filipino. I find it very odd that we're being affected. Nobody in the nursing department was affected, which I can understand. They're in direct care with the patient, and the hospital is all about the patient. But the services that we provide for that hospital are very, very, very much needed. And I feel if a private company was to come in, the relationship between the employees and the residents will go totally out the window. We have residents there that depend on us for everything. It was said before, I'm a housekeeper, I'll go in there, I'll feed a patient, I'll wheel a patient down to the coffee shop, do little things like that. Private companies not gonna do that. They don't care. All they care about is the money, all right? I'm a lifelong resident of Union County, born and raised in Raleigh. I care about these people. There's a couple residents there from Raleigh who I know personally. I care about them. So I want to keep my job. And just like everybody else, we all want to keep our job. And we want to make things happen for the hospital. We want to save the hospital. So we're asking, what can we do as the workers to help save the hospital? I also asked Ms. Wheeler one time, did you ever consider asking some of the workers, asking the people on the ground floor, asking the ones that keep the wheels turning, any suggestions on what we can do to help cut this deficit? Okay? Never got an answer. And the last point I want to make is, as a housekeeper, all right, if I was to come in and mop a floor and I didn't put a sign up, somebody falls, breaks their leg, I'm held totally accountable for it. I'll probably either get fired or some type of disciplinary action would be handed down. We have a finance director that's been operating on an annual deficit of $14 million, like the county manager has stated in his last letter. We have a hospital administrator that is facing a financial crisis and that has no strategy or no idea on how to get out of it. Are they being held accountable? They're not being held accountable. And just for the record, the morale, of the hospital has gone down drastically. And it's partly because of the leadership of the hospital. It's pretty sad when the hospital administrator comes up to you in the hallway and says to an employee, how's everything going? Oh, don't worry about it. The private company will pick you up. They'll put you on board. That's a lie. Because the private company never got a contract. So the hospital administrator shouldn't be saying that to us. And just the other day, I'm fixing myself a cup of water. Hospital administrator asked me, how's everything going? I'm doing well. My family's good. My kids, they're doing fine. She told me, I feel like you're lying to me. I said, okay. So I asked her, any new developments yet? She told me no. Well, I just want to tell her tonight that I felt like she was lying to me. Okay? I'm sorry to direct this at you guys, but you guys are her superior, okay, the way I take it, the way I understand it. So I'm calling for an evaluation of our hospital administrator, and our finance director. And before you go on with these layoffs, let's talk to them first, and let's take a walk around the 9 of you. Let's take a walk around Reynolds Hospital. Let's talk to some of these employees being affected. All right, find out what we can do to help, because we're the ones that actually get the wheels turning. All right, thank you.
Good evening, everyone. My name is Angela Moore. I've been with Reynolds for 30 years. Started from the old Reynolds before we became specialized Reynolds Hospital. I'm trying to take my time. Okay, we was taught to make teamwork, and I feel that
even a county worker, and she's up here screaming our laurels. I mean, it's a shame, and she's right. Our workers are out there working every day. These atrocities that are going to these workers, what they're doing. Our workers have clients, they have 600 caseloads, and you're asking our workers to take on, what, hundreds more when you let 20 workers go out? We gave up 12 openings, besides what we're losing. We gave up 12 vacancies. Promotional opportunities for our employees are gone. We gave them up. We're losing somewhat of 20 people on June 1st. And we don't know how many are going to be gone from bumping. And they don't know. They may find out the morning of June 1st, bye, today's your day, you got bumped. This is what you're telling our workers to work with every day. And the biggest atrocities, because of some mismanagement with monies, our last payday for these workers is May 22nd, and they're being told to work till June 1st. Because somewhere, people got overpaid. I guess the people who were hired in October of 2011 got a 4 weeks paycheck, because they have to work for 2 weeks and not get paid, because they've been told they already got that paycheck. And these people are being told to come in, and they will, because they're good workers. And this is the respect they get from you, is that we are not being dealt with on a fair basis. We're asking you to come back to us, to sit down with us. Our local gave you 2 pages of recommendations that weren't even acknowledged. We've given up. We've said we've given up. I committed myself, and I said I would write on a piece of paper guaranteeing 3 weeks that I would take as a furlough to save some of our single mothers who have 3 children, who on June 1st are going to lose their medical. So I guess they can get online with these workers, but don't expect too fast the services, because we don't have the workers to help you. Please, don't come for welfare, because there ain't anybody to work. So that's all I have to say. You have to reconsider this. These are good workers. They're homeowners in this county. They live in this county. They're taxpayers in this county. Don't make them part of our clientele. Thank you.
Lisa Bullock, Plainfield, New Jersey. I'm a Reynolds employee. I have a few suggestions of how we can save money. It might be too late, but just have a few suggestions. One way we can save money is nobody in the county should get a raise or a promotion or new hirees until this is sorted out, until you fix the problem with dietary, laundry, housekeeping. Nobody, counting from the top to the bottom, nobody should get a raise. Nobody, because if you have good people, the patients are going to suffer at Reynolds. The patients are going to suffer. I have 110 sick days. Been there 13 years. So now June 1st, I'm going to lose all those sick days. 110, I earned that. Nobody gave it to me, I earned it. Anybody who came in the door with me got the same amount of sick days as me, and I'm going to be out of a job because I was dedicated coming to work. You guys basically slapped me right in the face. Basically, you're telling me I shouldn't have been a caring employee. I should have just been taken off every week. I came to work, sick or not.
Only go in the building. And then all of a sudden, last contract, not this past one, but the one before this, we had a 4-year contract. We were told that we would get free medical benefit, lifetime medical benefits in that contract. All right, that sounded great. But as a month or 2 went by, criteria fell into place. 15 years at the age of 62. 25 years at the age of 55. It didn't affect me. It didn't bite. I would not benefit from it. So therefore, I voted against it. But even though I voted against it, I told people, if it works for you, vote for it. In turn, it passed. You took 2 years of my increases to fund a benefit program that I'll never benefit from. Now, what happened to my 2 years of increases that I didn't receive, as a lot of people that are in that same position? During the course of the years, as we started heading to the red, as I listened to everybody speak, you had to have been aware that there were changing times. We need to stop this wheel that's turning in a negative manner. Those who made the decisions and would bring people in there, you in turn fueled the problem rather than trying to find a solution to stop the problem. Now we're at this impasse where we're on our way out the door. June 1st is the date that I have been given as my last day to work at Reynolds. Now, when I started working at Reynolds, I had a week's pay that was held. So you're going to tell me that I'm going to lose it. I'm getting my last check on the 24th. Where's that week, that first week that I didn't get? 2 weeks. Where is that? So as you sit up there and you listen to us, think about this. One day, this could be you up at Reynolds or you in a nursing home, and I pray to God that you have caring people that are willing to wipe your butt, willing to do everything that's needed to help you, because if you come up with the wrong attitude, we're still loving people up there. I have been called names out of my name, but I have loved those individuals because they're there for a reason, and because they were there, that's why I was there. And that's where I accepted my being there. And I just pray that you all can find a solution to help the people that are coming up behind me. Fortunately, I'm on the other end of the ladder. But there are a lot of young people that are coming up behind me, because once I would have gotten 10 years, I would have stepped out so somebody else could step in. And that's what we need to do. We got too many old people up there that need to go. You need to get the youth of today working. This is why we have so many problems. They're not going into the military like they used to, like I did, so therefore they're out in the streets. They need things to do. They need jobs. No jobs, we become their job. So I pray that y'all one day wake up and smell the roses while you can. Thank you.
Ed Wazinski, President, Council 8. A lot of what I was going to say, my brothers and sisters on both parts said. What I still can't understand is you want to still privatize departments of Reynolds, and you have yet to show any union a piece of paper of any type, of any kind of money saved, or money's turned down, or any companies. These are things I think I should be entitled to when you get at least shown. Right now, I think it's just like you're trying to pull the wool over our head here. Because my thing is, if you can't find a vendor by June 1st, what happens? What happens? Because you have less than 30 days, and guess what? In 30 days isn't enough time to do contracts and hire people. The more you're going to push it after that, if you can't find a vendor, you know what's going to happen? You're going to cause more layoffs. Because this was started way too late, this process. It shouldn't be started at all at the beginning. Because now you're going to come down the line. If you push the layoffs up to, say, July 1st or August 1st, that's too much in your budget, you're paying more people. I don't want to see a third round. I don't want to see a first round. I got to go with a second. And now there's talk around the county that possibly a third round. I don't know that to be true or not. Maybe you could shine a light on it for me. I have no idea, but there's a lot of talk of a third round of layoffs coming. I don't want to see it. Actually, I'd like to see the first two rescinded, even though the first one's over with already. That people brought back. Because you know what's going to happen? You're going to save the money here, and in 2 years down the line, you're going to be paying twice as much. Because since, the last summer years, you privatized the print shop, you privatized the engineering department, you privatized the golf course. Now you want to privatize parts of Reynolds. I'm looking at myself going, hey, Ed, you got 3.5 years left. You might be gone next year. Who's next? This is what we're looking at. Who's next? So if things don't change, it's going to keep going. So I'm getting told already that you guys are in a hole already for next year. I don't want to go through this again. There's got to be ways now to stop and cut the spending so we don't go through this again. You know, like I said, I'd like to see some kind of numbers from the administration Reynolds to the freeholder board, anybody, to show any kind of savings that's going on by privatizing those 3 departments up the Reynolds. Like I said, till this day, and I said this the last meeting I was at, I don't want to repeat myself, but I still haven't seen that month either. I don't know if there's a problem, you guys, I don't know if they're afraid to show us, because there's no savings, they don't have vendors, how many vendors, I just don't know. And I'm getting asked a lot of times by my members on what's going on. Did they find somebody? Are they gonna hire us? I said, I don't even know. You know, I asked the last time about this, now I'm asking the second time. I'm hoping to get some kind of information on this. Like, and my other question, like I said, if you don't find a vendor by June 1st, what's going to happen? Because like I said, the longer you have to bring the layoffs up and you move them up to say 30 days or 60 days, that money's not equal in your, it's not in your budget already, because you're planning on the people to be gone June 1st. So that could potentially be more layoffs. And the longer that goes, if you can't find a vendor, that number's gonna grow. Right now, I think I'm at 158 in Council 8 alone. If you keep extending these layoffs and you don't find a vendor, that 158 could potentially go to 180 for me. Because it's gonna grow because you need to save that money. Because you're planning on having people out by June 1st. But I just need that question answered too on what's gonna happen if you don't find a vendor. Because it's like you're holding their job out on a thing, and when they go to bite like a fish, you know, you pull it back. And people shouldn't have to live like that to worry if they're gonna be out June 1st or they're gonna be extended a month. Is there a vendor? Is there a vendor? You know, it's just, to me, it's a joke, and it shouldn't be done that way. Thank you.
This is absolutely, the more I hear this, it's absolutely ridiculous. It makes me sick to my stomach. To sit up here and hear all of the money that's spent and wasted, all of the raises that have been gotten, and just like my brother over here, he was saying about his 2 weeks pay. I called Elizabeth today, and I've been working for Reynolds since 1985, and I asked her, where was my 2 weeks that they held in the hole? She told me that there was nothing, never anything held back. And I told her I begged to differ. So where is that? That's all I have to say, because this is disgusting. It's really disgusting to me.
Sheriff Taylor here, could she come up and try to clarify that pay period? If she's come up twice already.
How are you, Mr. Chair? In 2009, a decision was made essentially because we were faced with 27 pays to maintain 26 pay periods. If I can just backtrack and just give a little bit of information, because it is a complex issue that stems back approximately 3 years, I beg your indulgence. As previously mentioned, employees that are anticipated to be separated from the county June 1st, their last paycheck will be May 22nd. Employees essentially are prepaid, and the prepayment is a result of a payroll structure. Whenever we pay on a biweekly basis, in some years, you end up with 26, but almost every 10 to 11 years, you end up with 27 pays. The county opted in 2009 not to divide the base pay by 27. If we had divided by 27, the last paycheck in 2009 would have been December 31st. However, because we divided by 26 and avoided everyone taking home their same paycheck instead of a reduced paycheck, their last pay was December 17th. The first pay in 2010 on the same biweekly schedule would have been January 15th. However, in order to alleviate the hardship of having to go a full month without a paycheck, the county made the decision then to prepay employees effective January 1 for the subsequent 2 weeks. That decision and the impact of the biweekly pay schedule as a result of the Gregorian calendar was discussed with all union employees, with all union leadership in November of 2009. And that's where the rolling pay schedule came into effect, where when employees were paid in 2009 on a Thursday, in 2010 it was moved to a Friday, in 11 it was moved to a Monday, and in 12 we're now being paid on a Tuesday. So this decision stems back quite a while, and again, it was
from my understanding, geared towards alleviating a hardship of lowering the take-home pay by dividing by 27. So the young lady that mentioned every other employer maintains a biweekly pay schedule is correct. But in our case, we opted not to lower the base take-home pay by dividing by 27 and maintain it by 26.
Thank you, Director. That was discussed with union leadership at the time, and the decision was made back then. Okay. All right, can I have some order, please? And can anyone else wishing to speak, please come forward? You had a chance, ma'am. You had a chance. I would have to let everyone else that spoke have another opportunity. I'm sorry.
Marianne, you didn't speak. Can you come up and ask my question? Did you ask the people who were hired in October of last year why they're 2 weeks behind?
Yeah, we would like to know about employees hired as of October of last year. How does it affect the
Give me your name and home.
I'm sorry, I'm Marianne Adonna. I'm a social worker from Union County and I live in Roselle.
Okay. Director Taylor, can you address that, please?
Through you, Mr. Chair. Through an internal audit in the Department of Finance, the prepayment issue was addressed in, I believe, June or July of 2011, whereby employees that were hired after January 1, 2010, we made them whole because those employees then received 2 paychecks. For those employees that were hired in the latter part of 2011, they can attest, our payroll records will show, they received 2 paychecks on the first pay subsequent to their employment. For those employees that were hired after June 1, 2010 and forward, we went back and we issued them their retro pay after the internal audit showed that those employees were essentially short of pay. So they were made whole. And those records and the findings are also made part of the 2010 audit. So the prepayment issue is part of our official documents. We are aware of it, and we're trying to work with all of our unions to reconcile it. And unfortunately, the pay schedule is part of the negotiated agreements, and we have not come to a consensus with all of the units in order to resolve the issue.
And the records will show that each employee, what their pay was?
Absolutely.
All right, fair enough, thank you. Please, anyone else wish to speak?
Stay between of us.
All right, we'll wait just a minute.
They can't answer. They just qualify to answer.
They're gonna pay me ahead of time.
Just make sure they don't crowd on.
All right, Phil Kowalski, we'll move on to the
Thank you for coming in. I think we have stated before that we regret very much that these layoffs happened. There was a great deal of negotiation and going over the budget. There's more information that we can discuss after the local finance board rules. But at this point, this is the situation that we face, and we're required to balance the budget, and it's a terrible situation, and people's jobs are on the line with this. And again, I'm very sorry about it, as all my colleagues are. So let me just note something else that happened this week. The students from Hillcrest Academy made a presentation about youth and public safety at the Stanwood Police Academy. These are young people who would like to set up a youth center in Elizabeth. Unfortunately, because of the...
There a couple of times. My husband was up there about a year and a half ago. I know what a good job you do. I know how hard you work, and I truly appreciate it. So thank you very much for coming out this evening. That's all.
Thank you, Freehold Sullivan.
Thank you, Mr. Chairman. Yeah, just a couple of things as well. We do appreciate when people come out and express their thoughts. We understand the difficulties of anybody who's a job. I want to say something in particular to the people who work at Ronald's. You heard a lot of different reasons why there are problems there and the budget there. The one overwhelming problem at Ronald's Hospital is the continued cuts by the state of New Jersey for overpayments for Medicare and Medicaid payments. And you know, working there, that the vast majority of the patients there are Medicare and Medicaid patients. And those payments are made by the government to us. And every year, they continue to cut those reimbursements. Every year. That costs, when we talk about losing millions and millions of dollars, that's where it's happening. And there's no way to get that money back. No way to get that money back. Because Joan just told me, what is it, 80 or 90% of the patients there are Medicare and Medicaid. They're not the patients who are, for lack of a better term, the wealthier people who can pay the going rate. These are people that are standard rates, and it keeps getting cut. That's exactly what happens. And there's no way for us to recover that money. And if all the expenses remain the same, that's where the difficulty is. That's exactly where the difficulty is. When I first came here, Ronald's was losing millions, tens of millions of dollars a year, somewhere upwards of $13 to $15 million a year. The Medicare reimbursements over the years caught up. There were a couple years where Ronald's has never really made any money. Is not a money-making operation for the county. It was a service that was provided going back to the Bonnie Byrne days, way back into the 20s or so. And then over the last 5 years, the same pattern that we had that was earlier, the reimbursements cut again and again and again and again. And this year again. There is no way for us to recover from that. There just isn't. When they're paying $200 or $250 a day, and now they're paying $200 or $175. There's no way to get out of that. I know it's a difficult thing to say, but that's the reality at the hospital. It really is. And that's what makes it so difficult to try and balance the books. So I know that's something that folks don't want to hear, but that is the difficulty faced. And if you will notice, over the years, and that's happened in every county. And what has happened in every county? County after county has closed those hospitals throughout the state of New Jersey. And it's all for the same reason. All for the same reason. So, I mean, again, I apologize for going on like that. But that's the real reality of what is going on in that particular, in Ronald's, and just one part of what is the entire county budget. I hope that helps. Thank you, Mr. Chairman.
Okay, thank you.
This evening, I think that, yes, there are differences of opinion anywhere that you may want to look at it, but I think it is important to exchange views as to what's going on. I just want to pick up on something that Sullivan said earlier, and the amount of dollars that have been shorted from the budget this past year, the year before that, has been $72 million. The state of New Jersey has not applied with matching funds. Now, our governor has taken a position that he doesn't want to take any money that requires any match. He claims, because he said things happening in transportation, that if it requires a match, New Jersey does not want it. If they want to give it up, they'll take it. But other than that, that's the case. Now, that you're looking at a total of $144 million that's been left on the table that could have come to help residents not only of this county, but the whole state. This is nothing that I'm making up. This is real life that's happening and that's taking place. And that's something that has an impact. Are there many other issues on how we spend money and everything else? Of course there's going to be, and of course there's always going to be adjustments. We keep making adjustments. I know that we don't get the credit for the adjustments, but that's fine. We're big, we can understand that. But we need to remember that if, for example, just last Friday there was a meeting in Trenton at NJAC, New Jersey Associations of County, where the actual Secretary of, is it Health and Human Services? Stated that the state would like to go into a managed care model for all nursing homes in New Jersey. And if you,
since 2008, Runnels Hospital has been deprived of $6.8 million in Medicare reimbursements. And that was a decision that started before the current administration, but was that one that was kept in full effect. And
one, there were some, as was indicated, there were some individuals who have received promotions as a result of high-ranking individuals in positions where people have resigned. Having said that, there are also many other individuals in those higher level positions who have resigned, whose positions will not be filled. People who have resigned over the last few months and have indicated that they will be resigning in the next few months to come. Those positions will not be filled, but we expect to save approximately $200,000 by not filling those positions. Also, someone suggested that a hiring freeze be implemented while this is occurring, the situation is occurring, and that has already been imposed. So I just wanted to clarify those 2 points. And again, thank you all very much for coming.
All right, thank you, Al.